Okay. Assalamu alaikum everyone. My name is Noor Waseem and today I will be giving you the session on vitamins 1 and 2. I'm very excited to be here because it's my first ever session. So before I begin, there are certain things that I want you guys to know. So we will be covering two lectures, 1 and 2. So I remember back then when I had the session 2 years back, it was online. So renal was going on at that time as well. So I remember doing this session in a way, sorry, doing this lecture in a way that I could remember everything. So my one way was to make mnemonics, which I think really helped me, and I'll be showing that to you guys as well. Secondly, which is one of the main things that I'll be talking about here is according to your MOL blueprint, you will be having total 8 questions the uh, from both of these lectures, whereas majority of the questions will be from vitamins 1. Vitamin 1, which is basically the water soluble vitamins. So I'm not saying that you guys don't have to cover vitamin 2. You guys have to study both, but focus mostly on vitamin 1. 8 questions, like the most amount of questions out of all the lectures is from these two lectures, okay? So also, if you guys have any questions, please stop me or send me a message here. I can see my chat on the other device. Okay, so let's begin. Bismillah. Okay, so our objectives for today will be water and fat-soluble vitamins, the function of vitamins, the deficiency of vitamins, and toxicity of vitamins. According to Dr. Hannah, these two are the most important. Like you need to know that if a vitamin is deficient, what's going to be the disease or what will be the effect on the person. And you also need to know that if the vitamin is in excess and it causes toxicity, what's going to be the effect, right? So that's our main focus is. Other than that, I have mentioned sources for some vitamins, which is not really high yield, but you need to remember, okay? You never know. Doctors can give anything in the exam, okay? Okay. What are vitamins? They're also known as micronutrients and they're essential to the body in small amounts. Now, why are they needed? They're needed because they control the metabolic activity of the body. Now, as we progress, you will realize that most of the vitamins, they are important in producing some cofactors. And before I proceed further, can I ask anyone if anyone knows the meaning of cofactor or coenzymes? Anyone, like, you guys can say in the chat box or you guys can unmute and answer. Okay, so I'll go ahead with the definition. So cofactors and coenzyme, yeah, there someone said you needed to work with the enzyme. Exactly. So for example, you have an enzyme here, okay, and there's a reaction A which gives B, okay. Now for this enzyme to work, you need to have a cofactor or a coenzyme, okay, or a coenzyme. Let's say you do not have the cofactor coenzyme, this enzyme will not function and this reaction will not proceed, okay. Useless reaction basically. Okay, so again, classification, we have the fat soluble vitamins and we have the water soluble vitamins. Vitamin 1, which is water soluble vitamin, it will be mainly focused on vitamin, the B vitamins, like you see B vitamins and vitamin C, plus we have two more. Okay, and again, repeating, according to Dr. Hannah, this lecture will have the most questions in comparison to vitamin 2. Okay, so let's begin. Water soluble vitamins. Remember, they are vitamin B and C complex. Okay, now I want you guys to like kind of relate it to this phenomena, like when we drink water, obviously it's some of it is stored in our body and most of it is excreted, right, from by the kidneys in the form of urine. Same goes with the water soluble vitamins, it follows the same principle. So it is not stored in the body. Reason why? Because it is excreted via the kidneys in the form of urine. Okay, so because they're almost means like continuously excreted, there will be a problem when they're deficient because they're somehow leaving the body, right, through the kidneys. So there's always a problem when they're deficient. And most of them, water soluble vitamins, they are involved in the production of coenzymes. All right, so two main things that I need you guys to take from the slide is that vitamin B12 and folate, which are also water soluble vitamins, they are stored in the liver. Okay, a part of them is also excreted by the kidneys, like other water soluble vitamins, but they are also stored in the liver, which are B12 and folate. Remember this. This can be asked in the exam. Okay, so water soluble vitamins, like I mentioned, we have B complexes and C. You see, we have B, and we have vitamin C, and then like one is biotin and the other one is folate. So the one in purple, wait, both of them are purple. So basically, the one in blue is another name for the vitamin, okay, and the one in pink is the name of the cofactor these vitamins would give rise to. Okay, so I know it looks a lot, like remembering the vitamin and then remembering the other name, remembering the cofactors. Of course, it's a lot. It was a lot for me as well back then. I made mnemonic, so you guys don't need to worry about it. Inshallah, by the end of the lecture, you guys will know exactly what are the other names of the vitamins and what are the coenzymes or cofactors they give rise to. Okay, before actually going into the lecture, so I am sure Dr. Hannah would have somewhere in some of the lecture mentioned about the lovely coenzyme for nerds. Can anyone please raise their hand or tell me in the chat box if Dr. Hannah has covered this? Okay, yes, someone replied that it was covered in TCA. Exactly. So the lovely coenzyme for nerds. Now, for some of the water-soluble enzymes, you guys need to remember this. Okay, so I would just give you an overview before I actually explain the vitamins. Okay, so the lovely coenzymes for nerd, like I mentioned, uh, the enzymes, some of the enzymes, they do need a cofactor or coenzyme to act on them as a result to progress the reaction. Okay, if the cofactor or coenzyme is not there, the reaction will not occur. So we have certain vitamins, of which I would mention three here, which were also mentioned in your lecture. I think in your lectures two were mentioned, but there's another one that I would like to mention. Now, these enzymes, pyruvate dehydrogenase, alpha ketoglutarate dehydrogenase, and branched chain keto acid dehydrogenase, these enzymes require 5 cofactors. Okay, you need to remember this. This is a very important point. Pyruvate dehydrogenase, it needs 5 cofactors to come and act in order for its reaction to take place. Same goes with alpha ketoglutarate, and same goes with branch chain keto acid dehydrogenase. Okay, so what are these enzymes? It is a mnemonic, the lovely coenzymes for nerds. So all three of these enzymes, they need thiamine, which is B1. They need lipoic acid, which is not a vitamin. They need CoA, which is derived from B5. They need FAD, which is derived from B2. They need NAD plus, which is derived from B3. Again, don't worry. I know it can be confusing which coenzyme gives rise gives rise to which vitamin. It can be confusing. So I've made mnemonics. Don't worry about it. So let's go ahead. Okay, before I proceed, again, can anyone tell where exactly does pyruvate dehydrogenase work? Which reaction? Anyone in the chat box? Gluconeogenesis. Okay. Anyone else? Okay, someone said glycolysis. Okay, we'll see that. Okay. What about alpha ketoglutarate dehydrogenase? Which reaction is this here? Someone said to make acetyl-CoA. Very well done. Okay, so alpha ketoglutarate dehydrogenase. Someone said TCA. Okay, let's see where exactly they work. Okay. So pyruvate dehydrogenase, do not panic. I'm not going to talk about glycolysis or TCA cycle. I hate these lectures as much as you guys do. I'm just here to highlight what exactly these enzymes are going to work on. Okay, so pyruvate dehydrogenase, okay, it's going to catalyze the conversion of pyruvate to acetyl-CoA. Someone said acetyl-CoA, like it's going to convert to acetyl-CoA, which is correct. So it's kind of part of glycolysis, but it's leaving glycolysis and it's entering the TCA cycle. Okay. And then the other enzyme, alpha ketoglutarate dehydrogenase, give me a minute. Alpha ketoglutarate dehydrogenase. It catalyzes the conversion of alpha ketoglutarate to succinyl CoA. Okay, and it's very important for these both of these enzymes, rather this enzyme as well. But because I'm talking this picture, PDH and alpha keto glutarate dehydrogenase, it's very important for them to have all of these five cofactors in order for these reactions to work. For example, let's say I don't have thymine pyrophosphate and I have all the other four co-factors. This reaction will not work because it needs all the five cofactors. Same goes with this reaction. If any one of them is missing, this will not happen, this will not happen, okay? As a result, glucose is unable to produce ATP. Okay, clear? Any questions up till now? Okay, okay. Perfect. Okay, let's go ahead, guys. Okay, so this is a funny picture. I want you guys to tell me what exactly you see. What exactly you see in this picture? Just tell me in the chat. Whether it's wrong, whether it's right, just tell me. I want readout. I mean, I'll read out the correct option. Okay. I'm getting correct options. I think I can read it. Okay, someone is saying chips, but there's something else. What is this? Sorry. Give me a minute. What is this? This. Anyone? A bag. Okay. Okay, someone said packet of chips, and that's absolutely correct. Now, why is there a packet of chips? You guys might be wondering. Is that going to help us produce vitamin B1? I don't think so. So if you get a question in your exams about vitamin B1, remember that I showed you a packet of chips, and this exactly is the mnemonic. For vitamin B1, the mnemonic we have is packet. You know, from packet, just remove C. Who cares? Like, remove C, and E has no value here. So I'll tell you guys in the next slide why exactly we need packet. So vitamin B1, remember it's packet. And let's focus on the packet. Why do I have one? Why do I have T? Why do I have TPP here? So basically, this is my way of remembering things. I hope it helps you guys as well because it did help me in the exam. So you know how it's stupid, but I'll just explain. So one, it looks similar to T. So I can conclude, okay, vitamin B1, the other name is thymine because one looks similar to T, okay? And because thymine, the cofactor it's going to produce is TPP, okay? Perfect. And remember packet. So just remember in your mind, if a question comes, one T TPP, because one looks similar to T, and then packet. Okay? All clear, everyone? Any questions? Clear. Okay. 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 Let's go ahead. Vitamin B1. Like I said, remember one T TPP, this one, and remember packet. Okay. Now, vitamin B1 or thiamine, the other name. Look, Dr. Hannah can give you questions asking you anything about thiamine, but don't think that you didn't take this. Remember that it's another name for vitamin B1. Remember this. Okay. So this vitamin B1 or thiamine, it is a precursor for TPP, which is a cofactor. Like I said, cofactor is something that is required for the enzyme to work. If you don't have cofactor, that enzyme will not work. Hence, the reaction will not proceed, okay? Like the reactions we saw in glycolysis and TCA, okay? So when you have TPP, it's going to work on the following enzymes, which is basically pyruvate dehydrogenase, alpha ketoglutarate dehydrogenase, branched chain keto acid dehydrogenase, transketolase. A lot to remember, right? Well, it's a lot to remember. Just remember packet. So you know it's pyruvate dehydrogenase, P, pyruvate dehydrogenase, alpha ketoglutarate dehydrogenase. So A for alpha, and then you can remember keto because K is right next to it. Alpha keto glutarate dehydrogenase, branched chain keto acid dehydrogenase, which is I took from this K, keto acid dehydrogenase. You just need to add branch chain. And last one is transketolase. So I want you guys to actually get this answer correct if in case in the exam Dr. Hannah asks you TPP is cofactor of which of the following enzymes. Okay, so you guys need to know this. Also, going back to the lovely coenzyme for nerd slide, these are the enzymes that I mentioned above. And why are they mentioned under TPP? Because if you would go back here, um, thymine pyrophosphate, which is a full form for TPP, it is actually required by these enzymes. Okay, so because TPP is produced by vitamin B1, we have these enzymes here. Okay, remember packet as a mnemonic. Now, coming to deficiency, very high yield, almost asked in every past paper. And I remember even we got a question about it. So deficiency, it is called by alcoholism and malnutrition. So malnutrition is mainly in areas like underdeveloped countries, or I would say like the poor population over there. Okay, so how, what exactly happens and what are the diseases that are produced as a result of these causes? Okay, so in alcoholism, when there's intake of alcohol, so the thiamine or B1 absorption is interfered. Okay, so the body cannot absorb B1. As a result, your body will be deficient of B1. Now, talking about alcoholism further, so when thiamine absorption is interfered, you will have problems like memory loss, unstable walk. So alcoholism will give rise to Wernicke-Korsakoff syndrome. Okay, this is the disease that is related to B1 deficiency in alcoholics. Okay, next one we have is malnutrition, and due to malnutrition, the disease that is called is beriberi. Like I said, it's mostly in underdeveloped countries. So people over there mostly would consume white rice, and white rice is deficient of B1. They lack B1. So when there is no B1, these enzymes are not working, okay, in both alcoholics and in malnutrition. As a result, if I take an example of pyruvate dehydrogenase, you know how it's going from glycolysis to TCA cycle in order to produce ATP. ATP will not be produced, and when ATP decreases, what happens? Obviously, the brain is affected. So the name given to the disease called the malnutrition is beriberi, and it is a neurological disorder because the brain is affected. Main things to remember from this slide is this, okay? The causes and the names, okay? You guys don't need to really remember what memory loss, unstable walk, or whatever it is. And of course, this, okay? Scenario that could be given in the exam. A 25-year-old alcoholic man presents to the clinic and he feels severely lethargic. After CBC, he is diagnosed with thiamine deficiency. How would you deal with the patient? Whenever you approach a question in MOL, make sure you highlight the keywords, okay? So for example, over here, what came in our mind was alcoholic, okay? And then thiamine deficiency, which we just covered in the previous slide. And lethargic is like one of the symptoms of being extremely alcoholic, and then thiamine deficiency. Okay, so when alcoholic and thiamine deficiency comes in your mind, the first thing that should come into your mind is Wernicke Korsakoff syndrome. Okay, this one, alcoholism, memory loss, unstable walk. So this is one thing. Now you have got the concept that is Wernicke. Okay, so how would you deal with the patient? Now the person is lethargic and he is severely deficient of thiamine. Our body needs thiamine. We cannot keep the patient like that. So first thing that you're going to do, you're going to give the patient thiamine, and then after that you're going to administer glucose in IV fluids. So first will be thiamine, and after a while you will give glucose. If you do it the other way around, for example, you give glucose, this will exacerbate or increase the symptoms or worsen the Wernicke-Korsakoff syndrome. Okay, we clearly know the reason because if I would talk about this reaction, pyruvate dehydrogenase in glycolysis. So if that person was given glucose first before thiamine, glucose would come all the way here. After conversion, it will be stuck at pyruvate because the patient is still deficient of B1. Okay, so for this reason, we prefer not to give glucose because it will not be metabolized and it will worsen the symptoms. The symptoms. Okay, that is why first administer B1 and then we give glucose. When B1 is given first and then glucose is given later, B1 will first act here. As a result, ATP will be produced. The process will get back to normal, and later when glucose is also administered, the reaction will continue normally. Any questions till now? Okay, let's go ahead. Vitamin B1 is done. Okay, now we have vitamin B2 or riboflavin. Remember, so this is how I remember. It's B2 two. So we have two precursors, as in two cofactors that will be produced, which is FAD and FMN. So this is how I remember. Like, since it's vitamin B2, it'll produce two cofactors, and both of them start with F. So it's FAD and FMN. Uh, Not really important. But remember, the deficiency is caused by severe malnutrition, even more than the one that we had in vitamin B1. Okay, and they can also ask you in the exam that riboflavin, of course, its precursors are FAD and FMN, which are cofactors for succinate dehydrogenase, and all the lovely coenzyme for nerds, those enzymes. So remember, this has three enzymes that we mentioned up there, and for succinate dehydrogenase. Okay, can anyone tell me what reaction does this enzyme catalyze? Succinate dehydrogenase. Or can anyone tell me which cycle is it? This reaction, succinate dehydrogenase. Okay. Okay, someone privately said succinate to fumarate. Absolutely correct. And yes, it's a part of TCA cycle. Uh, Dr. Hannah can give you pictures in the exam with these, and she can ask you which of the vitamin is deficient. Okay, so remember, no mnemonic for this. You guys have to remember this. It's chelosis, which is inflammation of the lips. The lips are inflamed, they're kind of swollen, and there's scaling. Scaling, as in you guys see these lines, and features at the corners. So at the corners of the lips, you can see features as well. Glossitis, it is basically magenta or purplish colored tongue. Okay, and corneal vascularization. You can see vascularization here. Can you guys kind of see these blood vessels? I hope you guys can see. So she can get you this question. It's a very small vitamin. Just remember FAD, FMN. And then for these kind of cofactors, it's really simple, because the first thing, if any vitamin is asked, remember if they fall under this category. If they fall under this category, the enzyme that fall under this category would also be produced by this. Okay. Okay, let's go ahead. Now, vitamin B3, niacin, also known as nicotinic acid. Okay, here comes the kind of way to remember it. 333. You guys can see 333. Now, why is it 3 times? Okay, first of all, vitamin B3. This three comes here. Okay. Now, since almost all the vitamins have a name, has another name. One way how I remember that niacin or nicotinic acid belongs to B3, and not other vitamin, is because okay, so nicotinic acid, you see it has like three eyes, nicotinic acid. So it kind of always helped me, because vitamin B3, it has nicotinic acid, which has like three eyes. It's just way of remembering another name, not so important, honestly. And the last three is for the symptoms, or I would say for the disease that it causes when it's deficient, which is basically pellagra. Okay, and it causes, it's basically the symptoms are 1, 2, 3. It is also known as triple D. Don't write triple D in the exam. This is basically just a way to remember: dermatitis, diarrhea, and dementia. This is how you remember vitamin D3. Okay, now nicotinic acid, niacin, and vitamin B3, they are precursors for NAD. Remember that this enzyme will be required in high amounts, and it can be synthesized in the liver. This is also a very important point. For example, Dr. Hannah can ask you a question. Uh, uh, Tryptophan, which is an amino acid, can give rise to which of the following vitamins? Okay, she can give you vitamin 1, vitamin D, vitamin K, vitamin A, vitamin B3. Instead of vitamin B3, she can write nicotinic acid. So tryptophan, remember, tryptophan can give rise to this. Okay, all it's just one thing, same thing. So remember tryptophan, And NAD, as you guys must have studied a lot in glycolysis prep cycle, component of NAD, NADPH, which are cofactors for several dehydrogenases. And NADH, it is involved in ATP production. NADPH, it is important reducing agent in biosynthetic reaction. Important things are these two. Okay. Deficiency and toxicity, favorite thing of Dr. Hana to ask. Okay. So remember, vitamin B3, one of the three actually refers to the symptoms of the disease it causes. So, which is three Ds, triple Ds. So that in case of deficiency of B3, you will have pellagra, which is basically dermatitis, diarrhea, and dementia, triple D. You have to remember, dermatitis is basically irritation on the skin, and you can find this kind of structure on the face. Okay. And toxicity, when we're talking about toxicity here, I actually mean, when do we give vitamin B3 in high concentration, right? Normally toxicity is not good for the body, but there are some exceptions where you can actually give vitamin B3 in high concentrations, and it is usually given in high dose to for people to treat hyperlipidemia. You don't really need to go in detail, but remember, vitamin B3 can help to kind of maintain or manage your cholesterol levels, and can help lower the cholesterol levels or LDL levels in the blood, hence treating hyperlipidemia. Symptoms, obviously, if something is toxic, it will have a side effect. It's going to be facial flushing. Okay. Again, you can get this picture, facial flushing. It's extreme redness of the face. Okay. So you can remember that it's because of the toxicity of vitamin B3 in order to treat hyperlipidemia. And also remember that vitamin B3, its deficiency and its toxicity is more towards the face. In deficiency, one of the symptom is on the face. On toxicity, one of the symptom is of course on the face, which is facial flushing, and the other two, like diarrhea and dementia. Here for deficiency, it's basically what do you call memory loss. Okay. Vitamin B5, pantothenic acid. Now, how do you remember that vitamin B5 has another name, which is pantothenic acid? Well, a very easy way. Remember how, if I'm not wrong, I hope I'm not wrong, a pentagon, like pentagon has five sides. So this is how you remember that B5, you know, remember five is like pentagon with five sides. So that kind of like it's very similar to the word pantothenic acid. So remember, B5, another name is pantothenic acid. Okay. Comes another mnemonic here for B5. It is PAF. Okay. So pantothenic acid and PAF. Okay. What is this PAF doing here? I'll let you guys know. So vitamin B5, it is precursor for coenzyme A, which is basically required for metabolism of fatty acids. And again, if you guys could recall the lovely coenzyme for nerds, okay? If I am not wrong, I think it was the lovely so CoA, this coenzyme A is basically the one that is produced by pantothenic acid or vitamin B5, okay? So the enzymes that fall under TLCFN, the two major enzymes, they're also included here, okay? Deficiency is rare. Vitamin B5 is like all simple. It's like deficiency rare. There's nothing about toxicity, but just remember TLCFN, and they are required for fatty acid metabolism, okay? Any questions up till now? Anyone? Okay, so I'm assuming there are no questions. All clear. Okay. Okay. Vitamin B6 or pyridoxal phosphate. Again, this is one of the main ones, just like thiamine. So again, how do you remember that another name for vitamin B6 is pyridoxal phosphate? Again, it's a very weird way of remembering, but at the end, if it really works out, I think it's worth it. No matter how dumb the mnemonics are, if they work out, they're worth it. At least for in my case. So you know how with six, just try to invert the six, and it's kind of P, invert and like kind of reverse or change the side, it will form a P. So remember, vitamin B6, it's pyridoxal phosphate. Now, Vitamin B6, it exists in three forms, okay, which is pyridoxine, pyridoxal, and pyridoxamine, okay. They exist in three forms, but they are also vitamin B6, but the difference is that a different name is given, okay. So in the exam, you can be asked about pyridoxal, pyridoxamine, or pyridoxine. Don't get confused. The first thing that should come in your mind is they're talking about vitamin B6. Okay, simple. Now, what happens? Basically, all these the three P's, they are basically converted uh, into pyridoxal phosphate, which is PLP, which is a cofactor. Okay, so again, I repeat, all these three forms of vitamin B, eventually they are going to be converted to pyridoxal phosphate, PLP, which is a cofactor for two important processes. Now, you guys need to remember these processes, especially this one. So, PLP, it is involved in the synthesis of heme, and it is also involved in the metabolism of amino acid. Main thing that we will be discussing is P6, working as a cofactor in the synthesis of heme. Heme, okay, it's basically is one of the component of the blood, and normally it has iron attached to it. Okay, remember this because we will be using this principle a while after. So heme, a component of blood, has iron attached to it. So deficiency of vitamin B6 is going to cause a sideroblastic anemia. Did you guys do sideroblastic anemia in FND? If anyone could respond. Okay, okay, fine. Um, okay, some of them are saying we don't remember. And okay, anyway, sideroblastic anemia, I'll tell you what exactly it is. Okay, so basically, like I said, vitamin B6, it is like it is involved in the synthesis of heme, right? So it gives heme, right? So in between this reaction, there is something else that's going on. So B6 basically gives rise to ALA, which is a gamma aminolevulinic acid, which is going to form heme. Okay. Now, if there is no B6, okay, there is no heme, obviously, because B6 is deficient. So how will the synthesis of heme take place? It won't take place. So what happens? Because there is no heme, remember I told you normally heme is attached to iron. Now, because there is no heme, iron has nowhere to go. Where will iron go? So what happens? Iron starts to accumulate in the cytoplasm of the red blood cells. Okay, simple sideroblastic anemia. So it's basically iron accumulating in the red blood cells because there is no B6. There is no heme formation. As a result, iron cannot bind to the heme, and as a result, it's going to accumulate. So these blue particles here are basically iron floating in the cytoplasm because they don't have anyone to bind to, especially heme, the one that they're supposed to bind to. Okay. Next thing, another important thing, you know, here what's most important is sideroblastic anemia, pyridoxal phosphate is important, synthesis of heme. You guys need to know this picture. Another important thing here is basically there is a drug called isoniazid, which is used to treat TB, okay, tuberculosis. Now, this the structure or the molecule, the chemical structure of this drug, here you can see isoniazid, it is very similar to a form of vitamin B6, which is pyridoxal, okay? So what happens? When this drug is taken into the body, okay, this drug goes into the body, our body gets mistaken, thinking that, oh, I got a form of pyridoxal, I got a form of vitamin B6. I think I should be converting it into pyridoxal phosphate, okay? This is basically the normal reaction. So our body takes INH thinking that it's a form of B6. It's in a confusion that it's in the form of B6, and it tries to convert it to pyridoxal phosphate, PLP. If I'm not wrong, yes, it's PLP. Okay. So what happens, even though if it's converted into pyridoxal phosphate, it's in the inactive form. Because it is in the inactive form, it means B6 is deficient. Let me explain again. I'll come here. All these three, pyridoxal and pyridoxamine, they're basically uh, a form of vitamin B6 that is basically converted to pyridoxal phosphate in the body. Pyridoxal phosphate is the active form of B6. Okay, so if you have pyridoxal phosphate, means it is activated in the body, means you have enough B6. Okay, there you won't have sideroblastic anemia and anything else. But there is a drug which is called isoniazid, whose structure is similar to another form of B6, which is pyridoxal. So what happens when you take this drug in your body? The body gets mistaken that, oh, look, I got a new form of vitamin B6. How about I convert this into pyridoxal phosphate? In an attempt to convert into pyridoxal phosphate, which is usually normally the active form of vitamin B6, it is converted to pyridoxal phosphate, but because at the end of the day, it's not the real pyridoxal, or it's not the real vitamin B6 that the body has, right? It converts it into inactive form of pyridoxal phosphate. This will result in B6 deficiency, okay? So how do you deal with such a patient? Look, TB is something you have to treat, right? Like, just because of B6 deficiency, you can't say you can't treat TB. So for this patient, you give vitamin B6 supplements with the treatment to prevent deficiency, okay? So even though the body is getting mistaken with the treatment, thinking that and converting it into inactive pyridoxal phosphate, you give the supplement so that the deficiency is not there, right? So as to ignore the deficiency. Okay, vitamin B12. Another name is cobalamin. So it's used in the synthesis of DNA, thymidine, which is a nucleoside. It's used in the synthesis of DNA, which is important. You guys need to remember this. Okay, and the other one is in the metabolism of homocysteine. Basically, methionine is an amino acid, and when this amino acid is metabolized, it is going to give rise to homocysteine. Okay, and this homocysteine is a very, very nasty compound for the body, and it's going to increase the cholesterol levels, and it's going to increase the risk of myocardial infarction, strokes. So homocysteine is horrible. So there must be something that metabolizes homocysteine, and that's with the help of vitamin B12. Okay, when homocysteine is metabolized, the toxic effects of the of homocysteine is reduced. Okay. So, like I said, that vitamin B12, it is involved. It is one of the vitamin that is involved in the synthesis of DNA. So, in case of deficiency of vitamin B12, there will be a decrease in DNA synthesis. Okay, so there will be something not going right in cell cycle, because DNA is not being synthesized properly. Rather, there is a decrease which is not normal. Okay, vitamin B12, it causes megaloblastic anemia. Okay, so let's not forget vitamin B6 causes sideroblastic anemia, whereas vitamin B12 is going to cause megaloblastic anemia. How is this anemia caused? Of course, with the deficiency of vitamin B12, but there is a way, or I would say there is a very important cause that you guys need to remember, which can be examined in your final exam, which is a gastric bypass surgery. Okay, gastric bypass surgery is basically a surgery that is done on people for not everyone, like those who want to, for weight loss. Okay, now in this kind of surgery, like a particular part of your stomach is being removed. Okay, and there is something that's done by the surgeons, that I don't know, there's some replacement or there's some repositioning of the organ so as to change the way your food is absorbed, so the person can lose weight. Okay, so in gastric bypass surgery, when that specific area of the stomach is removed or cut out, what happens at times, uh, that that one specific area that's cut out actually has something called intrinsic factor. Okay, intrinsic factor is a glycoprotein. Okay, now this intrinsic factor, glycoprotein, it helps in B12 absorption. Okay, now if someone undergoes the surgery and this part of the stomach is removed, okay, so means intrinsic factor gone, B12 is not going to be absorbed. Okay, which is going to cause a deficiency of vitamin B12, and that is going to cause megaloblastic anemia. Okay, you can get this picture. So to recognize if it's megaloblastic anemia or not, all you need to see is that they're hypersegmented neutrophils. You guys see? It's like very segmented, and it can cause neurological symptoms due to abnormal myelin. Just remember it, not important. And in megaloblastic anemia, the RBCs are macrocytic, they're bigger in size. Okay, so two things you need to remember here in this slide is gastric bypass surgery, which is a very important cause of megaloblastic anemia. And the other one is folate deficiency can also cause megaloblastic anemia. Okay, so B12 deficiency and folate deficiency, both of them can cause megaloblastic anemia. Okay, any questions till now? Okay, no questions. Okay, so we have vitamin C or ascorbic acid. Um, very important again. Okay, remember the ones that I'm saying are important. They're actually important. They especially this vitamin C. This can be examined in SAQ. I think I came across an SAQ while solving back then about vitamin C. Okay, so it's an antioxidant, means it reduces LDL oxidation. Basically, when LDL is oxidized in our body, there are chances that it can, LDL is bad cholesterol, okay? So there are chances that this LDL can accumulate in the walls of the blood vessels or arteries, and it can cause a blockage. And as a result, there will be no blood flow. As a result, myocardial infarction, stroke, and cardiovascular symptoms, okay? So it's an antioxidant, means it reduces LDL oxidation, as in it reduces the buildup of LDL in the blood vessels. Okay, it's a good thing. Then it keeps iron in the reduced state. Now, iron, there is an oxidized state and there is a reduced state. So for iron to be absorbed into your body or to be absorbed in the intestine, you need to have iron in the reduced state. Okay, so one way to keep iron in the reduced state is to give vitamin C. Okay, this will quickly convert iron into reduced state, and your body will quickly absorb iron, and as a result, the levels of level of iron will increase. Okay, that is why people who are iron deficient, they're always prescribed to have this medication with, let's say, orange juice, okay, or something citrus, right? So as to increase the intestinal absorption and to kind of maintain their levels of iron in the body. And a very important thing is it synthesizes collagen. It's very, very important that it synthesizes collagen. I don't think so you guys need to know it, but yes, you doesn't mean that you guys skip it. You guys should know it. This is basically collagen, which is a material in the skin, especially. Also, you find it in blood vessels that keeps the integrity of the skin or the blood vessel. Okay, so collagen, it is basically essential for hydroxylation of proline and lysine. Sorry, my bad. Vitamin C is essential for hydroxylation of proline and lysine, because proline and lysine, they are going to undergo reactions which give rise to collagen, and this collagen is very important for our body. We'll see later what exactly I'm talking about. And vitamin C is a cofactor for prolyl and lysyl hydroxylases. Okay, so to summarize, in collagen synthesis, we need proline and lysine to be hydroxylized. Okay, remember, proline and lysine are very important words. Okay, so what are the sources? Very simple, must have heard a lot. Citrus fruits are very important. Okay, again, sources are not important, but don't skip them. Deficiency. Deficiency is caused by diet lacking citrus. Oh, sorry, it should be fruits. I put friends. Diet lacking citrus fruits and vegetable, and it can cause something which is called scurvy. Scurvy is basically bleeding gums and swollen gums, right? So also the deficiency is caused in people who consume tea and toast. It's very important to know this, okay? You must know what are the causes of deficiency, okay? So people who consume tea and toast, because it's only tea and toast, they're not taking any other kind of vitamins that are essential for their body, of which one of them is vitamin C. So this is going to cause scurvy, okay, and deficiency. And what are the what are the causes of what are the causes that are are produced as a result of deficiency? It is fragile blood vessels, again because no collagen synthesis. Vitamin C is low, no collagen synthesis, blood vessels will be fragile. Okay, swollen bleeding gums, you can see here. Again, a symptom of scurvy. Perifollicular hemorrhage, which is basically you have red spots around your hair follicles. Okay, you can, I think it's you can clearly see it on your arm if someone has it. And then there's poor wound healing, because again collagen is a very important component of clotting. So if there is with the low vitamin C, low collagen, clotting would not take place properly. And then there's easy bruising, which is known as ecchymosis. Okay, ecchymosis is basically bruising that is more than 1 centimeter. Okay, it's like a big bruise. Okay. Last two vitamins of water soluble vitamins. Any question up till now? Okay, I'll proceed. Last two, biotin. It is, of course, a water-soluble vitamin. It is required for ATP-dependent carboxylation reaction. One example is pyruvate carboxylase. Biotin, it is one of the vitamin that is produced by the gut microflora. Now, because it's produced by your body itself, by your gut or microflora or microorganism, the deficiency is going to be rare, right? Because it's something that your body is making, right? So it's a good thing that your body is making. So there is a rare deficiency. But if there is deficiency, it's not going to be because of your body. It's going to be because of something you intake. Okay. So there are some people who would love raw eggs in their milkshake. Okay. So raw eggs have a compound which is basically called avidin. Okay. Now what happens? Avidin has strong affinity to biotin. It binds to this biotin, to this water soluble vitamin, and so its activity is reduced. Okay. As a result, when it binds to it, biotin levels in the blood would decrease, and hence it is one of the cause of the deficiency. Okay. So if there is any question that talks about raw eggs, remember it's going to be biotin binding protein. Okay. Now, let's go ahead. Let's talk about folic acid. Folic acid, it is converted to tetrahydrofolate. It is a coenzyme for one carbon transfer methylation reaction. Remember, methylation reactions are reaction in which a CH3 group is added, okay, to a compound. It is important for the synthesis of nitrogenous bases in DNA and RNA. Now, I said that there are previously I said that there is another vitamin which is basically involved in the synthesis of DNA, and that is vitamin B12. Okay, so we have vitamin B12 that is involved in the synthesis of DNA, and then we have vitamin B9, which is also involved somehow in the synthesis of DNA and RNA. Okay, so deficiency. Who are the people who are mostly prone to deficiency or affected by this? Just a minute, I'm sorry about it. So who are the people who are mostly prone to deficiency or they're affected by it? It's basically pregnant women. Okay, so neural tube defects in the fetus, which is also known as spina bifida. So you guys need to remember it's very, very important. You can get an answer, you can get a question asking that what is one of the causes of folic acid deficiency. You can say spina bifida is caused by it. Okay, so vitamin B12 deficiency can cause folate deficiency. Like I said, vitamin B12 and vitamin B9, both of them are involved in DNA synthesis. So when there is a vitamin B12 deficiency, it can further cause a folate deficiency. How does it cause? It's not required for you now, but remember this, okay? Methylation reaction is very important, okay? All right. Yay, we are finally done with the water-soluble vitamins. And any questions? If you guys have, you guys can ask me right now. Otherwise, do you guys want a break? If anyone wants a break, please let me know. Okay. All right. Okay, so fat soluble vitamins are just four, so we can like quickly cover them. Okay, so inshallah, let's continue. Let's not stop. Fat soluble vitamins. We are done with water soluble vitamins. It's all up. Now we're going to talk about fat soluble vitamins, which is also your vitamin 2 lecture. There will be questions from this, but not as much as the questions that you might have from vitamin 1. Okay, so just for vitamins, we can like quickly go over. Okay, now fat soluble vitamins, an easy acronym to remember them is KAD. Okay, like it's KAD. This is how I remember it. Now these are needed in small amounts. They are absorbed by the enterocytes in the intestine, and they're associated with fat absorption. Of course, they're fat soluble, so they're associated with fat absorption. So in case there is a problem in absorption of fat, that is also going to affect all the fat soluble vitamins. Okay, one example is Crohn's disease, can be asked in an MCQ. Okay, for example, Dr. Hannah can ask, in Crohn's disease, which of the following vitamin is deficient, and the option she might give is vitamin B1, vitamin B6, and she can also give nicotinic acid, which is vitamin B3, and in the end she can say like vitamin K or vitamin A or something like that. Okay, one of these vitamins. So you have to choose this option, the one that has either K, A, D, or E. Okay, so now because they're stored in fats, so they're stored in fats, right? There's no way that they can leave the body. Whereas in the case of water soluble vitamins, I told you guys to remember the phenomena, like how we drink water, we excrete water, right? That is how water soluble vitamins work. You take in those vitamins and they're excreted by your kidneys. But in fat soluble vitamins, that's not the case, because they're stored in your fatty tissues. There's no way they can escape because they're stored within the fat. So when there's excess intake of fat soluble vitamins, that is going to cause toxicity. Okay. Whereas I told you in water soluble vitamins, toxicity is barely an issue. Instead, also deficiency is also not an issue there. Okay. Let's go ahead now. Talking about first vitamin, vitamin A. Now, vitamin A, it is a name given to several different molecules. Okay, they're still vitamin A, but the name is different. Okay, they're still vitamin A, but the name is different. Of which the main names that you need to remember is retinol, retinal, retinoic acid, and beta carotene. Okay, so retinol, it's by the name, all it ends with all, so it's a primary alcohol. Al, it ends with al. Retinal, it ends with al, it's an aldehyde, which is formed by the oxidation of retinol. So when retinol is oxidized, you get retinal. When retinal is oxidized, you get retinoic acid. Okay, and beta carotene is another form of vitamin A, which is present in plant food, especially carrots. Okay, beta carotene is a very good source of carrots. So that is why people who are deficient in vitamin A, they're often advised to have carrots in your diet. Like you can have carrot juice, or you can just have carrots. It's really helpful. Okay, sources again, not much important to be honest, but don't skip. Deficiency of vitamin A can cause night blindness. I will tell you guys why it causes night blindness. We're coming in the next slide. And then if there is severe deficiency of vitamin A, like severe deficiency, it is going to cause something which is called xerophthalmia, which is the pathological dryness of conjunctiva and cornea. Okay, your eyes will be dry in that case, in xerophthalmia. Okay, so in case of toxicity, there can be hypervitaminosis A. Okay, and those early signs are skin, liver, and CNS. Toxicity is very easy since vitamin A will be in toxic amount. Increased vitaminosis A, hypervitaminosis A. Okay, why does it cause night blindness? We'll see. Now, for vitamin A comes another mnemonic, like your first mnemonic for the fat soluble vitamins. Okay, so it is V brew. Now, here, V goes for vision, G goes for growth, R goes for reproduction, E goes for epithelial cells. Okay, so when talking about vision, vitamin A is a very important component for our eyes, and they're present in the rod and cone cells, which basically give us a visual pigment that allows us to see. Okay, so when there is no vitamin A, there is deficiency of vitamin A, what happens is that there is deficiency in rod and cone cells as well. There is no visual pigment. As a result, there will be night blindness. Okay, there will be a problem seeing at night or in dim light. Growth deficiency can cause decreased growth. When I said reproduction, I actually meant in terms of spermatogenesis. Spermatogenesis is basically a process in which involves the production and development of mature spermatozoa. When that happens, that happens with the help of vitamin A. Okay, and then the last one is E, which was epithelial cells. It helps in differentiation of epithelial cells and is involved in mucus secretion. Okay, I hope this is clear. So this is basically a summary of all what I said. Oxidation of retinol is going to give retinal. Oxidation of retinal is going to give retinoic acid. We spoke about reproduction. We spoke about vision. We spoke about promotion of growth. We spoke about differentiation maintains of epithelium. Remember, V grew. This is the mnemonic, okay? E has no value here. No, sorry, V grew. W has no value. V is for vision. G is for growth. R is for reproduction. E is for epithelial cells. W has no value here. So important thing is retinoic acid. When retinal is converted to retinoic acid can be used for several treatments. Okay, it can be used for the treatment of acne. It can be used for the treatment of promyelocytic leukemia. It can be used for the treatment of psoriasis. Okay, so the trans retinoic acid, which is also known as tretinoin. Remember trans, TT, trans, and then tretinoin. It is used for the treatment of psoriasis, and it is used for the treatment of promyelocytic leukemia. Whereas the cis retinoic acid, which is known as isotretinoin, it is basically used for the treatment of severe acne. Okay, you need to remember this. This is important. This is very important. Another important thing that I want you guys to know is that these tretinoin and isotretinoin, which is basically a medication, there are also medications under these names. These are basically teratogens. Can someone tell me what teratogen is? I'm sure Dr. Paul must have covered in embryology. What is teratogens? Okay, someone said harmful to the baby. Yes, exactly. So it's basically an agent which can cause harm to the baby because it can cross the placental barrier and then it goes to the baby and it can cause like adverse effects. Okay. Okay, let's go ahead. We will talk about this later. Now, vitamin A. Like I said, one of the treatment as a result of one of the treatment that can be treated with vitamin A is retinoic acid. Okay, another name is isotretinoin. So vitamin A, another name of which is isotretinoin. Another name in the sense that vitamin A, you know how one of the forms is retinoic acid, and we said that cis retinoic acid is basically isotretinoin. Okay, so this is isotretinoin. So when this compound is used to make a medication, the name to that specific medication, which is these tablets, you can see it's Roaccutane. Okay, so this is very helpful in treating severe nodular acne, like severe, not the normal acne, like severe all over the face, and it's nodules everywhere. Can you see this? Like it's too much. So Roaccutane or isotretinoin, it is used to treat this kind of acne. What happens? This medication, it is going to block the sebaceous gland on the face. Sebaceous gland are those glands that are oil producing or that are sebum producing. And when the sebum is produced, it usually causes further acne. And then when this isotretinoin, or Roaccutane, when it binds to that sebaceous gland, it is blocked. As a result, acne is controlled. Okay, so this also helps decrease redness and swelling on the face. But there's one very big side effect, like like it's like treating your acne, and then this big side effect, it's like hand in hand. You treat your acne or either you take care of the side effect. Like you have to choose one thing. Okay, so side effect is dryness, and that dryness is like extreme dryness to the point that not the normal dryness that we would experience as a result of the weather here, but the dryness, like you could literally see your skin being peeled off. Extreme dryness of the skin, eyes, nose, and lips, or wherever you apply it. But it's a very, very, very good treatment for severe acne. You can see the difference, you know, at a point where she had so much acne and redness and inflammation on their front face, and now she does not have. Okay, again, remember I said it's teratogenic. It can cause birth defects. Okay, contraindicated obviously in pregnant women because it's they're more prone to teratogens, and this medication is teratogenic. Okay, cool, we're done with vitamin A, and now we have vitamin D. Now, for vitamin D, you guys need to remember that the active form of vitamin D is 1,25 dihydroxy cholecalciferol, okay? And the precursor is 7-dehydrocholesterol. Very important to remember. Remember this, okay? This vitamin acts like a hormone in our body. Most reliable source is obviously the sun. Now, especially in Saudi Arabia, which there's like huge number of cases of people with vitamin D deficiency. Reason because the weather is extremely hot, and then most of the time people are inside their homes. They don't usually go out, right? Because it's really hot. So as a result, these people will be vitamin D deficient, and also because of wearing our clothes and going outside, like it can be kind of a barrier, especially I'm talking about abayas here, so it won't really help to absorb vitamin D in your body. So this is one reason why we have a lot of cases in Saudi Arabia. So when we have vitamin D, we need to make sure that it is converted into the active form, okay? Because when a vitamin is converted into active form, that is exactly when that vitamin is going to work on your body, okay? So how is vitamin D converted to its active form? So basically the answer is there will be two hydroxylation reaction. One of the hydroxylation reaction will occur in liver. Going back, I said precursor is 7-dehydroxycholesterol. Okay, now this 7-dehydroxycholesterol, under the influence of UV light, okay, it is converted to something which is called cholecalciferol. Okay, we're talking about vitamin D right now. So this precursor is converted to cholecalciferol under the influence of UV light. When that happens, this cholecalciferol goes to the liver. Okay, once this compound goes to the liver, it undergoes hydroxylation reaction, and the new compound that forms is 25 hydroxy vitamin D. This first hydroxylation reaction that I'm talking about is also known as 25 hydroxylation reaction because uh, it is at the carbon number 25 of cholecalciferol where a hydroxyl group is added. Okay, at carbon number 25, that is why it is called 25 hydroxylation reaction. You see how cholecalciferol was converted to 25 hydroxy? So it shows that this hydroxylation reaction on cholecalciferol occurred on carbon number 25 of cholecalciferol. Talking about the second hydroxylation reaction, occurs in the kidney. Now, this 25 hydroxy vitamin D, it is converted into 1,25 dihydroxycholecalciferol. Do you guys remember something? I said 1,25 dihydroxycholecalciferol. It is basically the active form of vitamin D, and this is what our body wants. Okay, so first hydroxylation reaction in the liver, the second hydroxylation reaction in the kidney. Okay, and this reaction is regulated by PTH. PTH is basically a hormone which is involved in the regulation of calcium, and this reaction is known as 1-hydroxylation reaction. Remember I said how like the hydroxylation that took place in liver is basically 25 hydroxylation reaction. So this one is 1-hydroxylation reaction, which clearly means that a OH group is basically added to carbon number 1 of a 25 hydroxy vitamin D. That is why when the hydroxylation is over, the new compound that forms is 1,25. Before it was only 25. After hydroxylation at carbon 1, it becomes 1,25 dihydroxycholecalciferol, which is regulated by PTH. Okay, that is exactly the reaction that I spoke about, but this is in a more visual form. This is basically hydroxylation 1. Okay, this reaction in the liver, the first hydroxylation reaction and the second hydroxylation reaction occurs in the kidney, and a name given to the first hydroxylation reaction is also 25 hydroxylation because OH is added to carbon number 25 of cholecalciferol. And a second hydroxylation reaction, the name that's another name is given is 1 hydroxylation reaction. That is because OH is added to carbon number 1 of 25 hydroxy vitamin D. Okay, that is why the final product is 1,25. Okay, this is basically what you guys need to remember. It's important. Now, functions of vitamin D, it is involved in increasing calcium and phosphate absorption from intestine. Okay, very important. Remember, it's about absorption. Calcium and phosphate absorption. It raises the level of blood calcium, of course, because if it's absorbing calcium from the intestine, there will be the concentration of calcium in the body will increase, right? So this will raise blood calcium. Then it also causes bone mineralization. Okay, so calcium is a very important component of our bone, and because calcium will be there, there will be more mineralization on the bone. Okay, so deficiency, like I said, it is called lack of sun exposure. For example, in Saudi Arabia, there's use of sunscreen, breastfeeding without supplementation. So it's normally recommended by doctors that when a woman is breastfeeding, she should also be giving baby the formula milk, because formula milk has it has vitamin D. So it's recommended by doctors to give formula milk as well as breast milk so that the baby is not deficient of vitamin D. Dark skin is also one reason why there could be deficiency, obesity, and use of non-fortified milk. Okay, again, remember that because of the deficiency, rickets and osteomalacia is caused. Rickets is basically in children. Osteomalacia is basically in adults. Okay, so talking about rickets, it's basically, so both of them, it's basically softening of the bones. Okay, and in children, it's more like bowing of the knees, like bending of the knees, that way, right? Again, it's the problem in demineralization, because normally there is bone mineralization. If there is no vitamin D, there won't be any bone mineralization. Okay, so the bone kind of weakens and it becomes very soft and weak. Okay, last two, very easy. Vitamin E, another name is tocopherol. Okay, so there are 4 different tocopherol compounds. The most important one that you guys need to remember is alpha tocopherol, which has vitamin E activity in humans. It is least toxic. Okay, like very important point. Antioxidant, like I explained before, antioxidant, vitamin C was also an antioxidant. So antioxidant means that it decreases the oxidation of LDLs. As a result, there won't be any deposition of clots or anything, or LDLs in the wall of the blood vessels. Okay, so it's a good thing. It reduces the risk of cardiovascular diseases, and also it stops the chain reaction of free radicals. We know how harmful free radicals are to the body. Sources: vegetable oil. Deficiency, it causes hemolytic anemia, and vitamin E deficiency can also occur in premature infants. Reason why it causes hemolytic anemia, let's say this is RBC. Vitamin E is it has a very important function in maintenance of the RBC membrane. Okay, now if there's deficiency, what happens is that the RBC membrane will break. As a result, there is going to be the breakdown of red blood cells, and this is going to cause hemolytic anemia. Okay, and it is also common in premature infants. Okay, vitamin K, yay, we're finally to the last vitamin, and it has different names. Okay, so how some of the vitamins have different names. They are vitamin K. They are the same vitamin, but the name is different. So we have phyloquinone, menaquinone, and menadione. So it is produced by our intestinal bacteria. Remember this, which means it is very unique of the fat soluble vitamins. Essential in blood clotting. I am sure you guys must have taken this in FND. These are the cofactors that it is involved with, and if there is no vitamin K, there will be a problem in blood clotting, and it is also important in bone health. It activates osteocalcin, which basically binds calcium to the bone matrix. Okay, it helps in strengthening of the bone. Deficiency can occur in newborn infants and people who take antibiotics. um, Newborns have a sterile intestinal tract, obviously because they're newborns, so there is no vitamin still in their intestine, so they need to receive a form of vitamin K at birth. Okay, now deficiency can cause hemorrhage. That is because if you have vitamin K, your good like your body is good in doing blood clotting. But if there is no vitamin K, or if there's deficiency of vitamin K, what happens? There will be no blood clotting and there will be blood loss. That is basically hemorrhage. Okay. Toxicity, remember, they produce hemolytic anemia and jaundice in the infant due to the toxic effect on the membrane. Again, membrane has a toxic vitamin K. Excess of vitamin K has a toxic effect on the membrane. As a result, it is going to cause hemolytic anemia. Okay, and over here I said vitamin E. It is good in maintaining the membrane of red blood cells. So when there is deficiency, it's going to cause hemolytic anemia. In vitamin K, when there is toxicity, it will cause hemolytic anemia and jaundice in the infant due to the toxic effect on the membrane. Okay, so yay, finally we are done with our vitamins. Are there any questions? Anyone? If there are any questions, sorry about that. Okay, so we will just be having a quick 5 minutes break, after which we will be doing the question, and that's it for the session. Okay, so just 5 minutes break. It's 8:16 now. I'll be back at 8:21. Okay. Just to just to repeat what Dr. Hannah said, vitamin 1 lecture, which is basically the water soluble vitamins, it will be having the most amount of questions, and vitamin B, vitamin 2 will not be having much questions. So make sure you're very well done with vitamin 1 lecture. Okay, so let's begin. Check points. Question number 1. Would anyone want like to read the question, or should I read? Anyone?
I'll read it.
Okay, go ahead.
Okay, so the vitamin involved in biochemical biochemical reactions concerned with the transfer of methylene or formal groups is a derivative of which of the following vitamins? A. Alpha lipoic acid. B. Biotin. Folic acid. D. Pyridoxine. E. Riboflavin.
Okay, so does anyone want to answer? Remember, we are talking about the transfer of methylene or formal groups is derivative of which of the following vitamins? We just did it, and I would give you a hint. We did it in water soluble vitamins. Anyone? Maybe you guys can write in the chat box. Okay, somewhat said C. Okay, wow, that's nice. I'm glad that you guys are. Someone's saying D. Pyridoxine. Remember, I told pyridoxine is vitamin B, uh, B9, I believe. Yes. So okay, let's see. Let's see the answer. So the correct answer is folic acid. So good job, those who said C. Now the reason why it's folic acid, I remember I told you and I mentioned it, and you guys need to remember for the exam. Folic acid is a coenzyme for the methylation reactions. And methylation reactions are basically CH3 reactions, which are basically one carbon transfer. Even the formal groups, they're also one carbon transfer enzymes. It's a one carbon transfer reactions. So folic acid is very important in methylation reaction, one carbon transfer. This is already mentioned in my slides, so that is why I've taken from my slides and mentioned here. And for those who said pyridoxine, or which is vitamin B9, if I'm not mistaken, I'm sure it's vitamin B9. My bad. It's vitamin B6. Very sorry, guys. It's vitamin B6. I just got confused. Um, it's vitamin B6, which is wrong. Okay. It's not vitamin B6. The reason for that is because vitamin B6 is involved in the synthesis of heme and metabolism of amino acids. Okay, so if there is a deficiency, it's going to cause sideroblastic anemia. But in case of that question, they were asking that which of the following would actually help in methylation reaction, and the answer is folic acid. I hope that's clear. It was a pretty straightforward questions. You can expect these kind of questions in the exam. Okay, now the second one, the activity of which of the following enzymes in the erythrocytes will be decreased in the patient with a deficiency of thiamine? Anyone who would like to answer? First, if anyone could remember, can you tell me which vitamin was thiamine? If anyone could answer, I'd be so happy. Yay, someone actually said yes, it's vitamin B1. Good job. Good job, guys. It's vitamin B1. So, what was the mnemonic for the enzymes under vitamin B1? Anyone? Okay. Someone said chips packet. It was, yes, it was packet. Okay. So what do you guys think? What would be the answer here? It'll
Doctor,
be
the answer is E, transketolase.
exactly. That's correct. Absolutely correct. You're right. Considering that the enzyme that need vitamin B1 as a cofactor, it's packet pyruvate dehydrogenase, alpha ketoglutarate dehydrogenase, and KK was branched chain, uh, that enzyme, and T was basically transketolase. So the only option we find here is transketolase. Okay, these are not the ones that are required, that require vitamin B1. Okay, so excellent job, good job. Remember packet? Remember, good. I'm very happy for those who remembered the packet, and those who remember the timing is B1. Okay, so these were the enzymes: branching ketoacid dehydrogenase, transketolase, and this is the answer. Okay. Next question. You are the attending physician in the emergency. You are examining a 48-year-old man brought by his wife because of recent changes in mental status. Physical examination shows horizontal and vertical nystagmus, bilateral facial nerve palsy, and truncal ataxia. The most likely explanation for this finding is the deficiency in which of the following vitamins? Answer, guys. Is it A, B, C, D, or E? Okay, someone said A. Anyone else? You guys can just write in the chat box if you guys don't want to unmute. Okay. Okay, so I think I will have to explain this question. So again, you guys need to highlight the main points. So it's a 48-year-old man brought by his wife because of a recent change in his mental status. Main thing, mental status. Physical examination shows horizontal and vertical nystagmus, bilateral facial nerve palsy, and truncal ataxia. So if you guys could remember, B1, it had two main causes. Okay, one was excess alcohol intake, and the other one was malnutrition. Okay, so over here, the symptoms that are being explained are of alcohol intake. For example, truncal ataxia. Ataxia is basically, the change in your posture while moving. The change in the way of your movement, like while you're walking, it's going to be a very weird kind of movement. Okay, which is of course one of the symptoms that you would see in people who drink excess alcohol. And then change in his mental status, a very big hint that his mental state obviously is not normal because he is taking excess alcohol. And then horizontal and vertical nystagmus, it is also a sign of what do you call it? It's a sign of uh, vitamin B1 deficiency. Okay, so the correct answer is vitamin B1. Although Dr. Hannah told that you don't really need to know the symptoms of exactly what each disease causes, but this disease was Wernicke-Korsakoff. Okay, And then it's logical, right? If a person is alcoholic, you would see changes in his mental status, in his truncal ataxia. Nystagmus is basically a movement of your eyeball, horizontally or vertically, like unconsciously. And then we have facial calcia as well. So know the ones that you know, or know the ones that you understand. Okay, so it's vitamin B1, and yes, that's correct. It's a Wernicke encephalopathy. You guys can read the explanation. um Okay, and then here is ataxia and all the symptoms that you guys need to know. Confusion is also one. Next question. As an essential component of nucleotide analog FAD, which of the following vitamins plays a major role in the transfer of reducing equivalents? Anyone who would like to answer? It's very easy. I think I told you guys. For sure, I must have told you. It's FAD. Here's the keyword. Okay, someone said C. Okay. Okay. Okay, now, as for those who are giving the answer as C, can I get a reason for that? Like, these are just straight direct questions. Riboflavin is the FAD precursor. Exactly. Dana, very good. It's exactly the precursor for FAD. So the answer is vitamin B2, which is absolutely correct. Also, if you guys remember, I told B2, right? It because it's two, it's going to have two cofactors, which is FAD, and the other one is FMN. Okay, so the moment you see FAD, you know that it's going to be B2. And as Dana said, she's absolutely right. Okay, so a patient has a series of blood clots and has been replaced on warfarin to reduce such incidents. Warfarin exerts its effects by blocking which of the following? Now, we spoke about a vitamin which was involved in blood clotting. I'm sure you guys must have taken that in FND. Anyone who would like to first tell me which vitamin is involved in blood clotting? Exactly, vitamin K. It is a very essential component of blood clotting. Okay. Now, second thing that I would like to ask here is what's the answer for this question? They're saying warfarin, which is a medication to reduce clotting. Which mechanism does it block here? Which one makes the most sense? Exactly. See, that is because warfarin is an antagonist. Antagonist, as in it opposes the action of vitamin K. It is an antagonist of vitamin K. When vitamin K is helping the blood to clot, warfarin is kind of opposing it in a way to stop its clotting, because obviously having blood clots in your body is not a good thing, right? So it can cause microthrombi, it can cause myocardial infarction, cardiovascular problems. So warfarin, which is basically which is basically an antagonist, with it's kind of blocking this mechanism, the clotting factor synthesis. Okay, so the rest of them not required for you guys. This one, no. Phospholipid synthesis, no way. And vitamin E activity, absolutely not. Okay, so exactly, it's clotting factor synthesis. Okay, now, a 9-month-old child of strict weakened parents is brought to the pediatrician due to perceived muscle weakness. Due to their strict dietary beliefs, the child has not been given vitamin supplements. An image of the anterior of the knee reveals cupped and widened metaphysis. As the child is very fair skinned, the parents always cover up the child when they go outside, such as that minimal skin is exposed to the sun. In order to correct this problem with the physician, prescribes the physician prescribed which of the following treatment for which of the following vitamins? Anyone who would like to volunteer an answer? Okay, someone is saying it's A. Okay. Dana, do you have any specific reason as to why it's A? Or Amina, is there any reason for that? Okay, first of all, we will okay, let's say the answer is A, which is basically vitamin D. But first, we need to it's responsible for calcium absorption. Exactly, Dana is correct. Someone is saying the child has rickets. Exactly. This is what I want you guys to come over. Remember, highlight the main point. So, first of all, 9-month-old child. Child is very like, remember, it's one of the main things of vitamin D deficiency. Like a child, children are very prone to vitamin D deficiency. So the children has not been given enough vitamin supplements. Okay, and an image of the anterior of the knee reveals cupped and widened metaphysis. Okay, now cupped and widened metaphysis means, now cupped usually means it's kind of like, this like oval kind of shape, and the knees are like bended, right? So it could bring in you the picture of rickets. If I could just bring that picture, it would be much easier for you all to understand. Give me a minute. Vitamin D, where is it? Oh, I'm very sorry. I think I didn't include those pictures. I will include them and then send the updated PPT. So, rickets is basically bending of the knees, right? So when the knees are bended and in a cupped shape, that basically kind of makes the bone widened, right? Especially from the area of metaphysis. So when the bone is widened from the top, like near the metaphysis, it means that there's something that's making the bone this way, right? So the first thing that should come into your mind is obviously rickets, because it's bended knee, a child with bended knee, and that's because it's caused by the softening of the bones. And in order to correct this problem, the physician prescribes treatment which of the following: definitely vitamin D. Okay, and another very important hint here is, when the child goes outside, the parent cover up the child when they go outside, so the child doesn't really get exposure to sun, right? So it could be vitamin D, obviously not vitamin K because blood clotting. Folic acid, no, because involved in DNA synthesis. Vitamin B12, again involved in DNA synthesis. Vitamin E, definitely not. Okay, so again, yay, the answer is vitamin D. The child has rickets, which is due to lack of vitamin D. And you guys can read this explanation, which I've already explained. So also, main thing, UV light is required to form the active form of vitamin D. Now, if the child is going outside and the parents are covering the child with a cloth or something on top, the child is not getting UV light to activate the vitamin D. Okay, we just have one more question. Oh, I think I showed the answer. Oh no. Okay. When vitamin D is deficient, which two orders occur most readily? I think I just gave the answer. What do you think? Dana is saying E, Amina is saying E, someone else privately texted and they're saying E. Exactly, rickets and osteomalacia. It's a very straightforward question. Rickets in children and osteomalacia in um, adults. Yes, the main symptoms of vitamin D is rickets and osteomalacia. It is characterized by improper mineralization. You know how vitamin D is involved in the absorption of calcium, which helps in bone mineralization. Now, when vitamin D is deficient, it's going to cause demineralization. Okay, so in other words, it's going to be improper mineralization, and which is going to result in soft bones. Okay, so osteomalacia, which is in adults, it is characterized by demineralization of previously formed bones, decreasing to increase softness and susceptibility to fractures. Now, when this happens in adults, they're more prone to fractures. Okay, because it's happening to them in the adult stage. Like, it's not that they got it in childhood and it's continuing in the adult phase. Osteomalacia occurs directly in the adult phase, where there can be more severe consequences such as fracture. Whereas for a child, when the child is growing up, you can expose them to the sun or give them formula milk, which has supplements. So that way, it's more easy to treat a child than the adult. Okay, guys, last thing, it's not a question. So this was one of the SEQs I got from one of the past papers. So this is basically an example of SEQ that you could get in your final exam. So obviously, it's just that they will give you a scenario and they would describe scurvy. For example, they would not describe scurvy. They would say, oh, the patient had swollen gums, or the patient had bleeding gums. So you would get the keywords quickly, and then okay, so it's talking about scurvy, where vitamin C is affected. And vitamin C is affected, one of the main causes is that there will there it won't be making collagen. Okay, so which protein is defected? Collagen is defected. Which protein is deficient? Again, I already gave you the answer. It's vitamin C. Which step of protein synthesis was impaired? Now, when we're talking about collagen, which is a protein, I would like to go back and explain, not explain, like briefly or go over it. It's here. Where is vitamin C? I think it's here. Okay. Another name, ascorbic acid. Remember, I said it synthesizes collagen. Collagen is formed when there's hydroxylation of proline and lysine. Okay, like these are the two components that are involved in the synthesis of collagen. When there is no vitamin C or ascorbic acid, it means there is a defect in the hydroxylation of proline and lysine. Okay, so this is kind of an example. So which step was problematic here? The hydroxylation of proline and lysine. And here comes the end of the session, guys. Thank you so much for those who joined. This was your last lecture. I really hope this helped you. And inshallah, it's an easy lecture. Honestly, it's an easy mark as far as the functions of the specific vitamins. Their other names. The cofactors. The deficiency in toxicity. It's honestly it's a very straight forward lecture. But inshallah, your exam is on Thursday. You have 5 days in between. I hope it goes well. And here's a little prayer that you guys can ask before your exam. Inshallah, hope it goes well. I'm sure you guys have been working very hard. Uh, you're almost done with first semester, and inshallah, next semester you'll be in second semester. And thank you so much once again. If you guys have any kind of question, feel free to email me. Feel free to text me. I'll be there to help you guys. And yeah, that's it for the session. And thank you so much, Maram, for hosting the session. And I hope this was helpful. I'd really appreciate if you guys could scan the QR code and let me know how I performed. So if there's anything that you guys didn't like or you guys liked, so it'll help me improve me overall as a tutor. So I would really appreciate. And thank you so much, guys, for joining the lecture. I hope, inshallah, it goes really well for you guys. Lots of prayers for you guys, and inshallah, you guys will ace the MOL final. Inshallah. Take care, guys. Bye bye.